Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
developmental dysplasia of hip or developmental dislocation of the hip. So in developmental dysplasia of the hip, there is subluxation or dislocation of the head of the femur occurs from the acetabulum. Mainly this dislocation of head of the femur from the acetabulum occurs before birth. So this is the head of the femur, and this is normally present in the acetabulum, but here this side the head of the femur is dislocated from the acetabulum, and this occurs before birth. So okay, this is actually associated with oligohydramnios, or it can be due to the high relaxin levels or intrauterine packing defect. So it can be either due to oligohydramnios, or it is causes are okay, it can be due to oligohydramnios. So whenever there is oligohydramnios, that is less likely in the mother's womb, then the baby is compressed. So whenever the baby's body parts are compressed, this can result in developmental dysplasia of hip. Second, high relaxin levels can also result in developmental dysplasia of hip, that is especially in female child. From the mother, the relaxin levels can reach the child, resulting in developmental dysplasia of hip. Intrauterine packing defect can also result in developmental dysplasia of hip. Then at birth, actually at birth there is a theory which is called as malpresentation theory. At birth, malpresentation theory or malpresentations can result in the uh, developmental dysplasia of hip. Like for example, if the patient has um, a breech delivery with extended legs and knees, that is if the child is like this with extended legs and also extended knees like this in the amniotic fluid, in such cases with extended legs and extended knees, that means there is developmental dysplasia of hip might be present, is predisposed in these conditions. That is, it is almost 10 times more in this presentation than rather than normal. Then we have postnatal theory. In the postnatal theory, that is after birth, if the mother carries the baby with hips and thighs extended, this can lead to developmental dysplasia of the hip.
thank you and thank you for watching.